Joining me now, we have the opportunity to discuss new techniques in the fight against breast cancer with surgical oncologist Dr. Krista Bott. Welcome, Dr. Bott.
Hi, thank you for having me.
So we are in the meditation room in the Dale and Frances Hughes Cancer Center. I love this room. I said it looks like it's my backyard. So thank you for joining us to share information.
Absolutely.
So let's start out by telling people a little bit about your role here at Lehigh Valley Health Network Pocono.
I'm a breast surgical oncologist, so I perform breast surgeries on women with both benign and malignant issues with the breast.
Okay, well thank you for what you do. I don't think I've shared this with you, but my mom is a 20-year survivor of breast cancer. Unfortunately, my aunt passed away from breast cancer, and so this topic is very near and dear to my heart. And as you know, October is Breast Cancer Awareness Month.
Yes.
So women have a lot of questions about breast cancer and mammograms. But I'm going to start with first, what exactly is a mammogram and when should I get one? And knowing that maybe depending on your age or your history, there might be different time intervals that you need a mammogram.
So a mammogram is a type of x-ray that looks for any masses, calcifications, or maybe most importantly, changes in your breast tissue from one year to the next. It's recommended that women of average risk start having their mammograms at age 40. We may start screening some women even younger than the age of 40, especially if they're high risk or if they've had family members who have been diagnosed at younger ages, so under the age of 50. Also, women with dense breasts may need additional imaging in addition to the mammograms, and those high-risk women also may need additional imaging as well. So the age of 40 is when we recommend average risk women start, and then once a year after that.
So how would I know if I have dense breasts?
So everybody gets assigned a breast density on their mammogram, so really the only way to know that for sure is to get a mammogram. And then everybody has a density to their breast. About 50% of women are dense and 50% of women are not dense.
Okay, that's good to know. Thank you. I wasn't aware of that. Can I put off getting my first mammogram if I have no family history of breast cancer? Because what I hear is some people are afraid to get a mammogram. One is because they don't potentially want to know the results, or they hear a lot of concerns about it's going to hurt. It's painful to get a mammogram.
It's not recommended. We diagnose a lot of breast cancer in women in their 40s and even some women in their 30s. So it's certainly not recommended to put off your mammogram. Most breast cancers are diagnosed in women without a family history. So even though we may not recommend that you start screening early without a family history, 40 is the age that we recommend women start without a family history.
Okay. And how about, does it hurt to get a mammogram?
Some people have sensitive breast tissue at baseline, and it might be a little bit uncomfortable, more of a pressure for those women. Most women have no issues whatsoever.
Are there red flags or warning signs that women should watch for in between mammograms?
Really what we're looking for in between is any changes in your breast tissue. So everybody's a little bit lumpy, so breast self-exams are something that we used to preach very, very much, used to hear all about them, but everybody was finding lumps because breast tissue by nature is very lumpy. We still recommend self-exams, but it's more breast self-awareness, so know what you feel like so you know if something changes. Also, any visual changes to your breast, such as a new nipple inversion. Some people have nipple inversion from childhood, but any new nipple inversion would be a warning sign. Or any bloody nipple discharge is a big one, or nipple discharge that leaks out.
Okay. Yeah, my mom found a pea-size lump that was very hard, and that was an indication for her that it was something different, and that prompted her to go to her physician and then ultimately see a breast surgeon.
Yes.
So what are some new developments happening in the fight against breast cancer? Because I know that you've introduced some new techniques and treatments, and what can people expect if they do get diagnosed? Tell us a little bit more about that.
So I think the most important thing to realize after you've gotten diagnosed is that worldwide we've gotten very good at treating breast cancer, and really the survival rate has increased so much for breast cancer because we have a good screening tool in mammograms that allow us to catch breast cancer at early stages for the most part when it's very treatable. One of the most recent and most important advances is 3D mammograms, so tomosynthesis mammograms, which we do have here and is becoming more and more prevalent everywhere. They're kind of replacing 2D. 3D mammograms allows radiologists to kind of see through some of the normal breast density and find out densities such as masses that don't belong. We have gotten more support from the government. Recently, Pennsylvania just passed a Senate bill, I think 595, that requires insurers to pay for the additional pieces of screening that I was speaking about with high risk or dense breasts, such as mammograms and MRIs. From a surgical standpoint, we have improved techniques drastically. 20 years ago, a lot of people were just getting mastectomies right away.
Right.
Then we moved toward breast conservation, so now a lot of people, most people in fact, get lumpectomies. We've then moved that forward, and now we do hidden scar surgery here. So we're a hidden scar center of excellence at Lehigh Valley, Pocono, and which that means because people survive at such high clips these days, there's many, many women who are survivors of breast cancer 10, 20, 30 years down the road.
Right.
It's now our goal not only to make sure you survive, which is the number one goal, but number two, I want you in 10 years to look in a mirror and not see a constant visual reminder of your breast cancer in the form of scars or asymmetry. So we do hidden scar surgery here, not scarless, but the scars are hidden. And also nipple-sparing mastectomies are something that's really becoming more and more prevalent. So the incisions with the nipple-sparing mastectomies are also hidden, and you keep your nipple. It's not something every woman can get, but it's something that's becoming more and more prevalent here and kind of everywhere nationwide.
It's wonderful to hear that we have these techniques available, you know, right here in Monroe County, and you doing the surgical technique, so we really appreciate that. One of the questions I hear is, do I need a prescription to get a mammogram? Or how easy is it at Lehigh Valley Hospital, Pocono, or to get a mammogram? Do I need to wait? Do I need to make an appointment? Can I walk in?
Yeah, there's actually no reason to not get your mammogram. For screening mammograms, you do not need an order or a prescription. It is best that you try to get one, especially if you see your primary care physician or your GYN yearly. They can easily order one, and then it might make the progression easier. But we have a scriptless screening mammogram program, so you can go in without an order or a prescription for a mammogram and get your mammogram. Additionally, lack of insurance coverage or poor insurance coverage should also not prevent you from getting a mammogram. We have grants that help us pay for women in those situations to get their mammogram at no to low cost.
So what I'm hearing is there's no excuse not to get a mammogram.
No excuse.
No prescription that's needed. You can walk in and get it, or make an appointment.
Correct.
So thank you very much for your time. Thanks for sharing this wonderful information. I told you that this is near and dear to my heart, and you know, look forward to people getting their mammogram in October or any time, right, as part of Breast Cancer Awareness Month.
Absolutely.